Hi, everybody. It's Nurse Lauren with Nursing Student Coach. And today I want to tell you what I think is the number one do and the number one don't when it comes to nursing exams. So, the number one do is to read each question twice. Sounds simple, right? Sounds easy. You might think, I already do that. But what happens when we actually get into the exam and that first question pops up on the screen? We get nervous, our hearts start racing, or we may see a question and think, I know that, I studied that. Pick the first answer that sounds good and move on. But you may miss one key word that changes the entire meaning of the question. So slow down, read each question twice, and read the set of answers twice before you confidently select your answer and move on. Also, when you read the question, if it is a simple recall question, a simple definition style question, try to think of the answer before you even look at the options. But reading each question twice, every single time, no exceptions, you make it one of your rules when you're taking an exam, will give you better results. The number one don't when it comes to nursing exams is don't change your answer. Statistically, if you change your answer, you will be wrong. Now, there are exceptions to this, and we'll talk about that. But how many times has this happened to you where you get a question wrong, you go back and review it, and you say, I had that the first time and I changed my answer? I know I was guilty of that in nursing school because so many times changing your answer is the result of overthinking. You know it, it's in you, you knew the answer, but you allowed your brain to say, well, maybe it could be this if. No. When you start having those thoughts of, well, maybe it could, I don't know, stop, go with your first instinct, because odds are you were right. Now, the exception to that is if you are 100% sure that you need to change your answer because, I realized I misread the question. Maybe you didn't read it twice the first time. Maybe you missed a key word that changes the answer. Or maybe you remembered, oh no, I remember this now. I remember this from my notes. And you are 100% sure. You're not overthinking. You're not second guessing and saying, oh, it could be this, it maybe. No, you are 100% sure. So let's go ahead and do one practice question to kind of put these principles into action, and let's see how it goes. I have a pharm question. Now, if you haven't taken pharmacology yet, don't freak out. We'll go through it. This is just applying principles. So let's get to it. A nurse is teaching a client who will start using transdermal fentanyl. Transdermal is through the skin. So we're talking about a fentanyl patch, which is an opioid. Which of the following statements should the nurse identify as an indication that the client understands the teaching? Okay, we read it once. Let's read it again. A nurse is teaching a client who will start using transdermal fentanyl. Start using, that means this is the first time they've used it. Transdermal fentanyl, through the skin, opioid. Got it. Which of the following statements should the nurse identify as an indication that the client understands the teaching? So what are we looking for here? What do we know? We know that the client is about to start using an opioid, transdermal patch, fentanyl. And which of the statements should the nurse identify as an indication that the client understands the teaching? We are looking for a true statement. So we're going to read through the 4 statements. The first time, I want you to think, what is my gut instinct? What is my gut instinct? And then we're going to read them again. And then you're going to pick your answer. And then we're going to go through them and talk about each one, why it's correct, why it's not correct. So here are your answer options. We're going to read through them twice. I can use an electric blanket while in bed. I will replace the patch every day. I should apply the patch to my upper thigh. I can take an oral analgesic for breakthrough pain. Now, let's read through them again. Did anything stand out to you as, I think that's the answer? Or did anything stand out to you as, that doesn't sound right? If not, don't worry about it. We're going to read through them again, and then we're going to go through them and talk about them. I can use an electric blanket while in bed. I will replace the patch every day. I should apply the patch to my upper thigh. I can take an oral analgesic for breakthrough pain. Okay, do you have your first instinct answer? Because I do. Now let's go through and I'll kind of walk you through my reasoning for picking the answer that I did. Okay, let's look at this one. I can use an electric blanket while in bed. To me, even if I know nothing about the transdermal fentanyl patch, that feels wrong to me. Why would I tell a patient that it's okay to use an electric blanket? That seems like a safety risk, first and foremost. But I also happen to know about the fentanyl patch that applying heat increases the release of the medication, which can lead to toxicity. And heat also causes vasodilation, which leads to increased absorption. And with fentanyl, with an opioid, the risk for toxicity and overdose is quite a significant safety risk. So we want to cross that one out. We know that electric blankets, heating pads, any sources of heat, hot tubs, a warm cloth, anything that involves heat and a fentanyl patch, wrong. Alarm bells should be going off. Wrong, wrong, wrong. Now, if you were looking for a false statement, if it had said, which of the following statement requires further teaching, which is such a common thing in nursing school, which of the following statements is wrong, you would want to pick that. But we're not. We're looking for the true statement. So cross that off. I will replace the patch every day. Well, that sounds reasonable. That sounds fine. If I didn't know how often, because that's what it's testing. It's testing, do you know how often the fentanyl patch should be replaced? If you didn't know, that could be one that you keep in the running and then maybe use the process of elimination, use just strategic guessing. But I happen to know that the fentanyl patch you replace every 72 hours, possibly every 48, depending on the patient, but it does release medication steadily over the course of 72 hours. So every 24 hours, it takes 24 hours to reach therapeutic levels. So that would not be the correct answer. So you want to cross that one out. That one's done. I should apply the patch to my upper thigh. Okay, this is asking you, do you know where is the optimal placement for a fentanyl patch? If you don't know, again, you would want to keep it in the running and maybe compare it to other answers and then pick which one is the best answer. In this case, I know that the best placement for a fentanyl patch is the upper torso. On clean, dry, intact skin, that is the best placement for optimal absorption. So you would want to cross out upper thigh. Now, this last answer, I can take an oral analgesic for breakthrough pain. That sounded correct to me on my first read, on my first instinct, because since transdermal fentanyl takes 24 hours to reach therapeutic levels, somebody who's taking fentanyl has moderate to severe chronic pain. So they would absolutely need an oral analgesic for that breakthrough pain until the fentanyl reaches the therapeutic level. So that would be the correct answer. If you got it right, great, good job. If not, don't worry about it. This is what practicing and drilling practice questions is for. And you'll see as you go through nursing school and you start to acquire more knowledge, you'll see that knowledge is power and that helped me to eliminate the incorrect answers. Of course, having the knowledge is the number one way to eliminate incorrect answers. But you can also use, does it sound right? Does that feel right to you? Or which answer sounds the most correct? If you know 100%, well, I know that that's true. I know that you would give an oral analgesic because it takes 24 hours to reach therapeutic levels. If you know that, if it's 100% correct, that's your answer. If you don't know, I don't know where you're supposed to put the fentanyl patch, let's pretend, or I don't know how often I'm supposed to replace it, but I do know that it takes 24 hours for it to reach therapeutic levels. So I know I'm going to pick this breakthrough pain. That's another way to answer it. But we read through the question twice. We read through the answers twice. We thought critically. We didn't overthink. And we went with our first instinct. So that's it for today. That's the number one do and the number one don't when it comes to nursing exams. I hope that helped you. I've got lots more for you, and I'll see you the next time. Bye-bye.